You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. I am thrilled to welcome back Dr. Aimie Apigian, a leading voice in the field of trauma healing. She's a double board-certified physician in preventive and addiction medicine with master's degrees in biochemistry and public health. But what sets her apart is how she blends deep scientific knowledge with practical, embodied approaches to healing trauma at its root. Dr. Aimie is also trained in functional medicine, neuroautoimmunity, nutrition, and trauma-informed therapies like somatic experiencing, neuroaffective touch, and the instinctual trauma response model. Her work sits at the intersection of medicine, biology, and somatic healing, and it's already changed thousands of lives. And what I admire most, though, is that this work is deeply personal for her. After adopting a child from the California foster care system and navigating her own severe health challenges, Dr. Aimie experienced firsthand how trauma expresses itself physically and how hard it is to find real answers within the conventional system. These challenges shaped her life's mission to understand the biology of trauma and help others break free. Her new book, The Biology of Trauma: How the Body Holds Fear, Pain, and Overwhelm, and How to Heal It, comes out in September with a foreword by Dr. Gâbor Maté. It offers an empowering new framework for healing, rooted in the science of how trauma lives in the body and how we can finally release it. Because here's what most people don't realize. The long-term effects of trauma aren't just psychological. Trauma leaves a biological imprint. Burnout, addiction, anxiety, depression, PTSD, pain, weight gain, gut issues, autoimmunity, and chronic fatigue, these are all part of the predictable patterns of unresolved trauma. And here's the key. To find the way out, we have to understand the biology that keeps us stuck in fear, inflammation, and survival mode, even when we're doing everything right. So today we're going to go deeper into what trauma really is, how it gets stored in the body, and what we can do about it. Starting with Dr. Aimie and her story. So first of all, Dr. Aimie, welcome back. It's a delight to have you.
It's a delight to be here, Palmer. It's always really good to see you, to be with you, to connect with you, and to support the work that you're doing in the world.
I love it. Well, what we're doing is inextricably linked. Can't say the word, but you know what I mean. Now, you've been on before, and that was episode 28 back in spring of 2024, and it was one of our most impactful conversations. But for those new to you, can you share a brief version of your story and what led to you to focus so deeply on trauma healing?
Sure. Like, my story is still surprising to me because I never saw myself on this path of leaving conventional medicine, running my own business, training practitioners. That was not where I thought my life was headed. And I even started residency in surgery because I thought that that was my path in life and had it all mapped out. And then everything changed. And it really started with me foster parenting and then adopting. And it so changed my understanding of the impact and what was needed for healing. I thought I had understood trauma, and I did not. I thought I understood the body, and I did not. And I have learned so much. And that's what I want to take to the world now. Because if I can learn this stuff and I can learn how to help unburden my body, I know that other people can as well. And it's actually not as complicated as we have thought. And there's so much that people can do for themselves. And I want to give them that information.
I'm so glad. That is so beautiful, and there is so much hope, and there are a couple of places that I want to level set, to set as context, and one of the ways I think it would be helpful for listeners who are mostly women who are dealing with and trying to heal from autoimmune disorders, let's call it age 30 to 60 and earlier than that, certainly. How do they know they could possibly be dealing with trauma? What would you say to them?
Well, now you're going into another aspect of my story because it wasn't until I discovered autoimmunity in myself that I really came to know my body is holding trauma and I have not known it. I had never seen my childhood as traumatic. It's not ever the word that I would have used,
Mhm.
and especially being a foster parent and then adopting and then starting a nonprofit working with adopted kids from around the world. I knew stories of trauma, neglect, abuse, and my story was nothing like that. So, comparing my story, I had come to the conclusion, who am I to say anything about my childhood, my life? I have been so privileged compared to
Yeah.
these other stories. And I ran with that story until I remember sitting in the doctor's office and looking at those labs and saying, how could I have autoimmunity? But that for me was a big message because as a physician, I knew the connection between autoimmunity and adverse childhood experiences. Adverse childhood experiences was a study that started in the 1980s. And it actually started with people who were going through an obesity program. And they discovered that the people who were losing weight started to feel a lot of anxiety, terror, panic, and would put all the weight back on. They would drop out of the program. And it wasn't until they started asking the questions, and this was Dr. Vincent Paletti, he started asking questions like, tell me what's going on, that it was uncovered. No, like being overweight is a solution to a problem that I have. It's not the problem, it's a solution to my problem. And so from there, it was like the veil had been pulled back and we saw how much of one's childhood actually impacted adult onset diseases. Knowing all of this, knowing these studies, having been taught them, I knew what autoimmunity meant. I knew that there was a strong correlation, and given everything else that was going on in my life, by that point, I was on 2 mood medications, Zoloft and Wellbutrin for anxiety, depression. They had diagnosed me with burnout, and I was 30 pounds overweight, and so I'm looking at all of the things going wrong with my health. Every single one of them was related to adverse childhood experiences. And that was when I realized I'm missing something. There's something about trauma that I don't understand. If my body is telling me we're carrying trauma, but my mind is saying, no, we're not. We've had a relatively privileged life. And that was when I started digging into what is trauma. By this point, again, I had still only worked with children who had had severe neglect, severe abuse. That was my definition of trauma. So then to come around and say, well, how might the rest of us have experienced trauma? But it was so subtle that we've downplayed it, that we've ignored it, we've belittled it, and we've told ourselves the story, what's wrong with you? Can't you be stronger? What's wrong with you? Why can't you get your life together? Why can't you get your health together? Why is your body doing this? So, autoimmunity was the turning point for my own personal journey. And that was when I started going into trauma therapies and realizing just how much my body was holding me back. But now I'm getting ahead of myself and I'm getting ahead of your
Yeah.
question. So, let me go
Yeah.
back to then, how would a person know that they had had trauma? We look at the body. We look at the body. We look at what is your body saying? There are these patterns. One of them is our physical health, physical conditions, diagnoses. And if that is suggesting trauma, then that's how we can know. And then we look back and we can look at our life and our history through a different lens and really ask the question, when have I felt trapped, alone, and powerless? When have I felt so overwhelmed I didn't see how I could move forward? When were things so awful and I felt so powerless that I didn't see how I could make this stop? And that now is really the definition of trauma for the body.
Yeah.
The time when we felt alone, trapped, powerless. And there are shifts that happen inside of us in our biology that create a trauma response. And we're often experiencing that without even realizing that it's happening.
Yeah. Beautiful description. And I've heard you say, and you can correct me anytime you like as we go through this, that trauma is what happens when we feel things too much too soon. It's that sense of overwhelm or not enough. And I love how you mentioned, we're all familiar with the huge traumatic events, the rape, the car accident, the sexual abuse. Those are big things that we can see. But I love that you also shine a light on the things that we don't see, the neglect, the people that weren't there when we needed them. We didn't feel that support. It's not to throw everything into the trauma bucket, but there are a whole lot of us that try to explain away things. Oh, my childhood wasn't that bad. I didn't have those great big things. But you are inviting everyone to come into the tent to see, if your life is manifesting in any kind of symptoms, it's an invitation to explore because just maybe this is a key that is worth turning to unlock more freedom.
Exactly, because the body's going to hold on to those experiences of overwhelm. It doesn't just magically go away with time. One of the biggest misunderstandings and honestly lies that I was even taught is that time heals all.
Mm.
And it's not true. The other lie is that children are resilient. No, they're not. Their bodies are absorbing everything that's happened in their environment, and their body is holding on to that. You don't see it in the moment. You may not see it for another decade, 2 decades, 3 decades. And that's why autoimmunity is more common in that 30 to 60 range, because that's when it finally is surfacing. Not that it hasn't been building, it has. It's been building behind the scenes, underneath the surface all along, because our bodies are absorbing all of this. Now, there is a way for us to learn how to not accumulate more trauma. And we don't need to hold on to experiences. But until we know exactly what's happening inside of us and then what to do, our bodies are going to hold on to those experiences. And like you described, it really comes down to a simple equation. And this is one of the core concepts that I would want people to get out of my book, this equation. And the equation is simple. The equation is danger on one hand and my capacity in the other. And is the danger that I sense in my life, in my responsibilities, in my family, in my relationships, in my career, in my health, all of these stack up. And all of a sudden, we feel all of this danger in our life. And then we look at our capacity. I mean, when I say we look at our capacity, it's our nervous system looking at our capacity and making the list. Do we have the finances to meet these problems? Do we have the energy to meet these problems? Do we have the social support? Do we have the wisdom, the knowledge, the experience, the training? And so often it falls short. And we look at our capacity and it's like, we don't have enough. we're not enough. There's no way that we can face this mountain of danger that feels like it's presented to us. And when that equation creates the gap, the trauma response is in the gap. And our nervous system, to protect us, will shut us down, putting us into a trauma response when we feel that our capacity is simply not enough for the demands and the danger and the threats in our life.
Love the definition because it makes it so clear you can understand how to minimize the danger, how to increase our capacity, and hopefully work on both, right? Um, I want to touch on a few more context setting things because there are a lot of people talking about trauma, what it is, how to heal, and some questions that I have fall in the category of, what's the very best that we can do or hope for? Can we, and then I'm going to give you some words and you correct me and tell me what word you like to use because we can talk about healing trauma. We can talk about transcending it, digesting it, integrating it. We want to get past it. We want to move on with our lives having this full capacity with very little danger. And I've done the trauma work. I am beyond it. Is that a possibility for us? Or is this something that is going to be lifelong? That those of us who experience this childhood trauma and, as those studies suggest, more than 60-70% of us have, um, what would you say to that? What's the best we can hope for?
You use that word hope, and that was actually the word that's been key for me because when I first started this, I didn't have hope. And that's even what they taught me in medical school, Palmer. They taught me that these are the consequences of trauma. These are the consequences of adverse childhood experience.
Mm.
Look at the studies. And this is the best that we can expect. This is what people can expect. And so our job, my job as a physician, your job as a practitioner is to tell them that this is what led up to this diagnosis and this is the rest of your life.
Mm.
And I was even told that when I was diagnosed with the autoimmune. I remember specifically asking because I hadn't found functional medicine yet. So I remember asking that question that many people ask before they go over to a more functional medicine side of things. And I asked, is there anything I can do to prevent this from becoming a more severe autoimmune condition? The answer was no, of course. And that's not true, but that's the best that we can expect according to the studies and certainly my training in conventional medicine. So then when I lost my health and all of a sudden I am struggling to even get out of bed and I'm looking at, is this the rest of my life? That's why I went on my journey, knowing that it needed to involve trauma therapy in order for me to try to get my life back. But I did not know if it was possible. So I started in a very hopeless place. And the whole reason why I do what I do now is because I have so much hope. I have so much hope, and I want other people to know what is possible. The word that I have come to use is repair. Trauma breaks us, and we're standing there, and our life feels like it's fallen apart. Pieces all over the floor, shattered. Our health can reach that point, and we've got to repair the pieces. Talking about going from broken pieces to masterpieces.
Mm.
How do we do that? Well, it's through repair. We learn how to repair. It's not learning how to erase because we can't erase the past, but we can repair what's been broken. And there are 3 levels that need repair. And when we can repair all 3 of those levels, anything is possible. And not only anything, Palmer, what I've seen is this is when people truly become the best version of themselves and a deeper wisdom, understanding compassion than what they would have had otherwise. So, not to say that trauma makes us a better person, it does not. But the repair creates the possibility truly of going from those broken pieces to the masterpiece.
Could not have said it better or imagined anyone saying it better. Love that, from the broken pieces to the masterpiece. And to imagine the possibility that you can move through this and repair this and maybe be better than before. Might be different, but I truly believe that what we go through is an invitation to become who we truly are, and that is a masterpiece. If we can recognize that, oh my goodness, Dr. Aimie, that's so, so, so hopeful. Okay, thank you for doing the level setting with me, because it's just helpful to know, what's the goal that we have when healing. And it's so hopeful to know that yes, this might have happened to us decades ago, but we cannot continue to sweep it under the rug. We do need to look at this. And so you talk often about trauma as not just being psychological. But your work shows that it does leave this biological imprint. So could you please walk us through what actually happens in the body during this challenging experience? And I thought it might be useful to provide a contrast. Like, what should happen in an optimal situation? Maybe a parent and a child, if you want to go that way, or any kind of metaphor you want to use or story you want to share. This is somebody that probably won't have a trauma imprint. And then share with us what happens in many cases, and we might be able to identify ourselves in this particular story.
Yeah, a common story that I hear a lot is some version of a car accident. And this is actually the very first story that I share in my book. So, chapter 1, I open the book with Elena in a car accident. And she developed autoimmunity a few years after that car accident, by the way, because what happened and what often happens, whether it's a car accident or any other situation, is that there's this lack of repair. And in a situation where we feel that we've lost control, overwhelmed, for her, she had tried to outmaneuver the car and then realized there's nothing I can do. This car is still coming straight towards me. It's going to hit me. And then we start to have those thoughts of, I don't know if I'm going to be okay. I don't know if I'm going to survive. So this is a life threat that's now inescapable. She'd done her best, wasn't enough. It's an inescapable life threat. When that happens, what happens inside of us is that our nervous system has kicked into gear and it's kicked on the sympathetic system. The sympathetic system is what gives us energy. It's what allows us to think so fast, faster than our logical mind. We can jump out of the way of a car without even realizing that there was a car coming until after we've jumped. It's the use of adrenaline and even noradrenaline that's pre-stored in our tissues to allow us to take action at a superhuman level. This is really important because when we feel that energy, we feel so strong. We feel alive. And this is where people can get addicted to the sympathetic system because of the aliveness that they feel with it. Adrenaline junkies, we call them. I believe there's a term for that. So the sympathetic system is there to help us do our best, take action to survive. So there's all of these other changes in our body that happen with the sympathetic system in order to give us energy. We can look at the whole body in terms of the circulation system and the changes in the flow of blood that help us take action. But even if we go down to the cellular level, if we got out a microscope, we're like, okay, like what's happening here inside of a cell? It is like a busy city metropolis that has all of these different functions. And in the moment that this kind of danger presents itself, the whole city pulls together in the most efficient, miraculous, way to create the most energy possible and use up the least amount of energy possible. Meaning, I'm only going to use energy for my survival right now. We're not going to clean out the trash. We're not going to pick up the kids on the school bus. Like, those systems shut down because all of the alarm systems have turned on. And what's really important to know is that this increases our energy production in our mitochondria, those factory houses that actually make ATP or our energy. And you can see this on the microscope. The mitochondria, where the energy is being made, it changes shape in order to maximize how much energy it can make for us. Our whole body up levels itself in order to help us survive, overcome. And in the case of Elena, that wasn't enough. That whole process happened. Noradrenaline got secreted, and then the adrenaline and all of these blood flow of change, and then the mitochondria. So she had all of this massive energy driven by adrenaline, and it wasn't enough. And when it's not enough, what do? What does the body do? The body takes all of that and says, well, if that's not how we can survive, the best way for us to survive is to shut down. And the survival strategy here is to stay alive, but barely stay alive. And this is where we have heard the stories of what the animal kingdom principles are, where this idea of if I hibernate, my metabolism shuts down, which means that I'm cooler and my predator may not notice me because I'm not this warm being, which means my breath will also need to decrease because they might hear me breathing, which also means that I must become very still because if I'm moving, my predator might see me. So it's all in alignment with what we've already been taught for the science, but it's this idea that this is now the trauma response. This is no longer the stress response. The stress response is high energy, aliveness, adrenaline. And what we see is that the body has this critical line. And that critical line is crossed the moment that our body realizes that the amount of energy that we can produce is not going to be enough to meet and overcome the danger. Again, we come back to this equation of demand and capacity, danger and capacity. And so it's an internal energy problem that decides whether this will be a stress response or a trauma response for the body. If we are able to overcome, we never go into a trauma response. And then we don't need to worry about recovering from the trauma because we never went into a trauma response. But what I see is that so many people are no longer able to generate the amount of a stress response that they need to overcome a problem. They're giving up before they overcome. And that giving up then puts their body into a trauma response. So once we go into a trauma response, what do we need then in order to not have that be something that our body holds? There's this idea of repair, but I'm going to bring in a different word now, which is completion. Completing the response. The body operates with rhythms and cycles. And even with our breath, we can see that it takes in a breath, it inhales, and then to complete that breath, it has to exhale. What if we didn't complete the breath? Well, we would keep inhaling and then inhaling and then inhaling and then we'd pass out because we need to complete these responses. And that's exactly what happens with the trauma response. The trauma response is not bad. In fact, it's part of being human. And the more that we can understand when it's happening and then just know how to complete it, we don't have to worry about it accumulating and causing all of this damage that it has. And so it's very much like completing a breath. I notice myself going into shutdown. I'm completely overwhelmed. I feel alone, trapped, powerless. Something has been too much too fast, or it's just been too little for too long. And I go into my shutdown and How do I complete that? Most people are trying to push through that when what we actually need to be doing is completing it. Pushing through means, "Ooh, I don't like this feeling. I don't like
Mm.
feeling shut down. I don't like feeling numb. I don't like feeling dead inside. I don't like feeling empty inside. So let me go grab some coffee, some sugar, some chocolate, some food, exercise, overworking. Let me create some drama so that I can get some adrenaline and try to pull myself."
Mm.
So we try to pull ourselves out or push ourselves through rather than letting the body have its response and completing it. And so if the body never completes it, that's when it gets stuck because it never senses that, "Oh, I'm glad that's over now." It never gets the reset to safety. It never knows that it's over. So now the body feels like the danger is still there and it operates as if the danger is still there. And that's when we see people cycling between the two survival states, either the stress and the adrenaline or the shutdown. And oftentimes it's cycling all throughout the same day. By the time people come into my courses, they're often waking up in a shutdown response. How do I know that? I ask them, "What is your first thought of the day when you first wake up?" And their response is often some version of, "I don't want to be awake.
Mm.
I don't want it to be morning. I don't want to get out of bed. Can I just go back to sleep and make it all go away?" But that's not an option. And so what do? Well, I already told you. What we do, our tendency is to push ourselves through or try to pull ourselves out. And so we maybe stay in bed until the last possible minute. And guess what that gives us? It gives us adrenaline because, like, "Oh my goodness, now I'm going to be late. Now I'm going to be late to work. Now I'm going to get the kids off to school late." Now, and we've got this adrenaline that we're using drama and stress and adrenaline to pull ourselves out of this heavy place that we find ourselves. But that's not enough, right? And that's why we have coffee makers, and oftentimes we have coffee waiting for us so that we can crawl out of bed and go and get our coffee, which gives us dopamine and adrenaline and helps pull us out of that state of, "I don't even want to be awake. I don't even want to be in my life right now. My life is not a place that I want to be." But we medicate ourselves with adrenaline through all these different ways, not allowing our bodies to repair at all because we're pushing, we're pulling rather than repairing and completing.
Yeah. Thank you for that beautiful response. I want to go back. Her name is Elena, the car accident. So maybe I want to see a picture of what, and I haven't read the book because I don't have a pre-order copy. Can't wait to read it. Um, what would a repair, a completion response look like versus someone who continually pushes it down or pushes past or seeks, to self-medicate with food, caffeine, and so forth? I'm just trying to imagine so that I can see a story in my own life of where I may not be paying attention. I may not be listening properly. I would love to know so that I can be really honest with myself. Where am I not? You hear me say myself? Where I'm not completing things.
Oh, so thank you for asking this. The ideal would be that after the car accident, the paramedics arrive. Elena is still in a bit of a daze, but they do their thing. And their thing is asking a ton of questions. "Do this, don't do this. Where are you? Do you remember what happened?" All of these questions, rather than the ideal, which would be as long as she's okay, there's no big life threatening emergency, give her time. When we give the body time, what will happen is that her body will naturally start to come out. And it's almost like I describe it as waking up. This is what I mean, for lack of better terminology, it's what it looks like for someone to have gone into that shutdown place. It's foggy. They're not thinking clearly. They look a little spacey. They're searching for words if they're talking at all. And then to see them come out of that. And it's fascinating to watch the body because when the body is given the time that it needs, it does this all by itself. We don't actually
Mm.
control it. And a person will start to feel their body. When we go into the shutdown, we stop feeling. It's part of the survival strategy where if we're going to die, I'd rather not feel it. And so our body uses hormones and endorphins to shut off feeling. And then we start to feel, and that's where you'll see someone on their own start to move their hands. And then they'll start to move their feet. And it's almost just that checking in with their body of like, am I still okay? Am I still attached? And this is where sometimes they may find like, no, I broke my arm. I'm not okay. But until they wake up out of this, they're not even aware of that often. And when we can give them the time for this awareness to come back, it's allowing the body to follow its own rhythm, which will allow it to complete the response. The next thing that happens after a person becomes aware of their own self and their own body, and they've started to do a little bit of movement to check things out, they'll start looking around their environment. So, the first thing that a person will do is they will become self aware of their own body. Feeling will start to come back. And then the impulse will be to scan their environment. Okay, now that I've checked in with myself, where am I? They've lost sense of where they even are. And they'll want to turn their head and they'll want to look at people and around them. At this point, they still haven't even talked because the body's not ready for that yet. And so they'll do this whole scanning of their environment. And this is really important because without that, the body still senses, but there could be danger because I haven't looked all around.
Mm. Mhm.
And then they'll want to engage people and then they'll want to talk. And then there's this reconnecting with humanity of, wow, I survived this. I'm alive and I'm going to be okay. And here's what we're going to do to help me be okay. Now let's go to the hospital. Now let's get into the ambulance. Now let's put this cast or sling on my arm that's broken. But that's not what we do. And in fact, in any situation where we find ourselves going into that place of just, it's like shutting down, right? It feels like all of our energy just got deflated. We want to curl up into a ball, into the fetal position. What we often do is just like what the paramedics do. Oh no, we can't do that. What might happen if we actually allowed ourselves time to just shut down? That's not safe. Let me try to pull myself out of it. The paramedics are trying to pull them out by talking and talking and talking. It's very disruptive to the body that's just gone into hibernation and needs time. It needs time, and we don't give it time and we don't give ourselves time. Instead, we also find ways to pull ourselves out of that and snap back into it, right? Like get our focus back, get our energy back,
Get over it.
get over it. And what it creates is just further disconnect because my mind is trying to do this. It's trying to focus where my body is still falling apart. Yeah, it's connected. But I've now disconnected from my own body, leaving my body abandoned, alone, and without support. So this is the sad reality then is that we actually perpetuate so much of our own trauma experience because we abandon ourselves in the
Mm. I can see that, and I can see it both in the case of a one big traumatic event like the car accident, and I can see it very deeply in the more insidious long-term childhood trauma of neglect or abuse. And in both of these cases, it sounds like you're suggesting that a cycle of completion is needed. Is that what you're saying?
It's exactly what the body needs. The body needs to complete its rhythms. So Again, I want to reinforce this because it's a common misconception that we've labeled trauma as bad. A trauma response is being human. This is what our bodies do. And our bodies will go into this trauma response whenever it feels that that's the best strategy to help us survive something that feels so big and so painful. And so the goal in life is not to avoid trauma at all. The goal is to learn how to complete its responses so that it doesn't stay stuck in our bodies and make us sick. We don't want to be trying to avoid trauma or trauma responses. Trauma responses are not bad. They're uncomfortable. And now that's a whole other discussion, Palmer. That's a whole different podcast episode of
Yeah.
why are people unable to tolerate discomfort now?
Yeah. Yeah.
Why are people so uncomfortable with the uncomfortable that it puts them into shutdown? But that's a different topic for a different day.
And I will have you back and we'll talk much more in many different directions if you want to, because this is central to everything.
It
Uh,
really is. It becomes central to everything.
It is central to everything. So in the interest of time at this moment, you have a number of avenues of ways that people can enter into your world to begin to complete the trauma healing response. And so I would love for you to introduce the things that you'd like to talk about. I want you to speak about why you wrote the book, um, in any order that you would like.
Yeah, no, why I wrote the book is very much my whole mission in life right now is to give people hope. And from what I've learned of the body, how it experiences trauma, what constitutes a trauma response, and how to do that repair. This is something that I feel is so essential for a human being to have a good life. And what I see so often is that people are not seeing the trauma in their body. They're having challenges, especially in their physical health, and they don't realize all that they could do to undo that, to repair that, to step beyond that and have a better life. So, this idea of this book, I wrote it to be the manual for a person for their body, the manual for the nervous system. Here's how your nervous system works. Here's why it goes into a trauma response. Here's what's needed. Here's what you can do. Even if it's been decades later, here's still what you can do. It's all about the repair of the mind, body, and biology.
Beautiful. I love how you simplify the complicated and give people not only hope, but the very concrete steps they can take. And you also offer a program. It's 21 days. And I wonder if you want to touch on that because I'll put everything below in the show notes. Some people are visual learners and they love to participate in a group. And I have found this to be an enormously helpful program. And would you like to say a few words about it?
Sure. The 21-day journey is where I start people in learning how to work with their nervous system. And it's not ever going to be enough to learn about it. I need people to experience it. So, this 21-day journey is a journey into a person's nervous system, not just about, we're going to go into. So, I teach them every day a different guided somatic or body based exercise that shows them so much of their inner world, teaches them how to recognize the state that they are in and what to do about it. So many people come to me with this idea that, oh, I just need to connect with my body. And I'm like, well, that's the first step, but that is not going to be enough. I need you to learn and know how to respond to your body, how to work with your body, how to befriend your body and get yourself on the same team so that you're actually working together for your best health and your best life.
Your body is your best ally. And so for you to provide a manual that helps us to understand how to befriend it and tend it and do these exercises so that we can completely repair and complete those responses that never got repaired or completed. This is so hopeful, and I'm so grateful for you, Dr. Aimie. And I believe this is the first of a series of interviews that we need to do because trauma is complicated. There is a lot to it. It implies a lot. It brings up a lot. But this was an amazing step in our understanding of how to repair and complete the trauma response.
Well, again, thank you for the work that you do in the world, Palmer. It's very important and obviously near and dear to my heart, given my own history with autoimmunity.
Well, right back at you. I'm so grateful for you, Dr. Aimie. Look forward to the next time. Until then, be well, my friend.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.